Hello everyone, welcome to my YouTube channel. My name is Onesimus and you're Onesimus the Fashionable Nurse. In this tutorial we are going to look at components of nurse-patient relationship. We're going to look at components of nurse-patient relationship. But before we continue, if you know you are new on this channel, please hit the subscribe button in the corner down here and click on the bell which has two arrows on top so that you can always be receiving videos whenever I post. Thank you. So let's continue. Components of nurse-patient relationship. We shall first look at nurse-patient relationship itself. By definition, nurse-patient relationship is a professional and therapeutic relationship between a nurse and a patient that is aimed at fulfilling the health needs of a patient. So, this nurse-patient relationship, it is aimed at fulfilling the therapeutic needs of the patient. So it is not personal relationship, but it is a therapeutic relationship. And it comes as a result of several interactions of a nurse with a patient. We have some of the components, and number one is trust. For you to build good relationship with a patient, you have to be trustworthy. You have to know how to keep promises, and by doing so, patients themselves will also start entrusting you. And then you also have to be respectful. Respect. And this is where most of us have failed. Instead of respecting our patients, we want patients to fear us. We want patients to fear us. And I can assure you that whenever you make a patient fear you, you are losing out some information from the patient, because they will be fearing to tell you everything. Like someone whom they are close to. And this one will make you to fail to meet your therapeutic goals. So, in this case, you have to learn someone's behaviors and you get the way of how to cope up with them. For example, there are people who want to be respected. If you find a client has that kind of behavior, you have to look for the way of handling him or her. There are some people who like joking every time. If you find you have that, you're handling that kind of a client, you have to look for the way of how to handle them. But don't always make them to fear you. Identify their behaviors and learn how to socialize with them. And socialize with them peacefully. That's when your relationship with them will be promoted. Then another component is professional intimacy. Professional intimacy is like closeness between you and the patient, between you as a nurse and the patient. And this one comes as a result of several activities that you do for the patients. Psychological activities, physical activities, or spiritual activities that you do for the patient. For example, helping the patients to bathe, turning the patients in bed, counseling them. They now reach an extent of sharing personal information with you. For example, like at home, problems that they have at home, how they don't care about them at home, how they contracted the diseases. You find someone sharing with you everything about himself, but this one comes when he or she has entrusted you. Then the fourth component is empathy. Empathy is like understanding someone's emotions and you share the feelings with them. For example, someone can tell you all the story about their problems and you just say sorry. Even the way you say sorry shows that you don't care. But under empathy, it teaches us that even when you are saying sorry, you should show it out. Your feelings should come out, and that's when your therapeutic relationship will also be strong. And the last component is power. Power makes you different from a patient. As a nurse, you have power to advocate for the patient. For example, if the patient needs something from the doctor and they cannot explain themselves, you can help them out. You can advocate for them. And as you continuously keep on doing so, your relationship with them also increases. And this one will help you to meet your therapeutic goals. Remember, you do all this to meet your therapeutic goals, to make sure that the patient becomes okay. These are components of nurse-patient relationship. Thank you for watching this video. Don't forget to subscribe, like, and if you want to share with me something, put it in the comment section. Thank you. Bye.